I'm very glad, actually, to be speaking just after the presentation from Philips, because I think our two topics may complement each other very well. What I would like to do now is to highlight a different dimension to a pure, if you like, a kind of a technology, medical devices focus on digitisation of healthcare, and specifically looking at the role of medical knowledge and patient information in enhancing clinical decision making and the clinical workflow. And when we talk about medical knowledge, we mean the body of information which informs the identification and understanding of the conditions causing ill health, the signs and symptoms that inform medical diagnoses, the selection of appropriate treatment plans, and of course the education of patients so they can be part of shared decision making and the role they have to play in getting better and staying healthy. And of course, I'm focusing on this concept of medical knowledge because it is central to the role that Elsevier plays in healthcare. We combine medical knowledge and technology to provide information systems that support and inform clinical decision making. Our headquarters are in Amsterdam and London, but of course we're working with healthcare institutions, doctors and nurses across all of the EU and worldwide. So I was very interested in the overview from Bertelmans in particular. But ultimately it's always about helping to ensure the delivery of care and development of the clinical workforce and their professional capabilities. It's all about making sure that is based on a high quality and current medical evidence base. Now, if there are any clinicians here in the room, they will know that a key challenge faced today is simply keeping up with the sheer volume and pace of development of medical knowledge. So to put this in context, it's been estimated that back in the 1950s, if you thought of all of the medical knowledge that was published in the entire world, at that time it would have taken 50 years for all of that knowledge to double. And that by 2010, that doubling time had reduced to 3.5 years. And the projection was by 2020, next year, that the doubling time would be just 73 days. So if you were to think about this in relation to something like cancer, currently the second leading cause of death in the EU, of course, there's been an absolute explosion of information and options available to GPs and oncologists today, from the discovery of the first cancer treatment drugs back in the 1940s, through to the predictive tests, the genetic tests that are available today. And it is the development of disciplines like genomics in particular that are opening up that whole new vista of medical knowledge. Of course, there's a huge mass of patient data being generated through whole genome sequencing, as well as improved data capture for the individual patient in electronic patient record systems. So that means that big data is now a very powerful source of what we term real-world evidence to complement what has classically been thought of as the development of medical knowledge through research and clinical trials. So the digitisation of healthcare is about more than creating the infrastructure for capturing and connecting patient information. It's also about using technology to transform medical knowledge into specific actions, and very importantly, to tailor those actions into clinical decisions that are specific to the particular circumstances of an individual patient, the patient-oriented focus that Mr. Boni started with. So I would like to share with you actually just one example that we have worked with Great Ormond Street Hospital in London. It's a world-famous international centre of excellence in paediatric care. Every day, over 600 children suffering from complex medical conditions come to them. And a few years ago, we started working with a team responsible for the endocrinology and metabolic wards. Now, these paediatric disorders are highly complex. Children often suffer from multiple conditions, and so the care pathways are highly complex as well. And therefore, those pathways require multiple rounds of dynamic investigations running in parallel or consecutively. So each investigation involves a repeating cycle of tasks to get to a diagnosis and the optimal treatment. And very careful management is needed of those pathways to mitigate against the risks for patient safety associated with some of the diagnostic tasks. When you're dealing with disorders of the endocrine system, some of those tests can actually be quite high risk if they're not managed carefully. The problem is the sheer volume of tests being generated and the challenge of dynamically scheduling time-critical tests meant that at Great Ormond Street they found the doctors and nurses, their time was increasingly being absorbed by administrative tasks on paper. So the clinical leadership team realised a different approach was needed to overcome that problem. And that led to the project that we worked on with them to develop a new online electronic care pathway management system powered by our Arezzo active clinical decision support capabilities. And that involved the transformation of medical guidelines, documents, and clinical protocols into highly granular data points and recommendations for individual actions. The decision support software is able to dynamically cross-reference this highly structured medical knowledge against the very specific details of the individual child that's been treated that day. And because the algorithms are dynamic and not static, they can automatically track the testing schedule and generate personalised medical recommendations for the doctors. And those recommendations are updated and refreshed as each cycle of tests is completed and more information becomes available. So if you're not a clinician and you're not familiar with this sort of cycle of testing, a very simple analogy is to think about the change that we've gone through in driving. It used to be when you're planning a journey in your car, you had a big map printed on paper and you plotted it out and you followed that map. Whereas today, we all use a sat-nav, and the system is able to respond dynamically to congestion on the road ahead in relation to your current location and keep updating it. And that's essentially the same thing that's happening there. I mean, I have to say, Great Ormond Street is world famous for a reason. They were already delivering exceptional clinical care to the children. But I'd like to give you a quote from the clinical project lead, Dr. Catherine Peters. She is the lead consultant in the paediatric endocrinology and diabetes area. And what she said was that digitisation of the care pathway allows our medical staff to spend more time on the ward of patients and not buried in paperwork. So there are the added benefits. They are also seeing less wastage because there is a reduction in errors in the orders being requested and mistiming of samples. And some of these tests are very expensive. But because they're high risk, there's a natural tendency to order things just to be on the safe side if the clinicians are not confident about where the pathway is at. It's electronic, it's online, so you no longer have the problem of the loss of paper documentation. Information is recorded in real time, uploaded into a document management system. But I think we would all agree the most powerful impact of all is that the nursing team now has visibility at all times of all of the patients, all of the children in the ward, and the precise actions that they need to be carrying out to best care for each patient. I think that has a real resonance with some of the comments that were made in the examples from Philips as well, where that tension between high quality care and the time available for a stretched workforce. So to conclude, I chose that one example today because I think it's a very powerful example of the potential for content-driven advanced clinical decision support to deliver improvements in healthcare. It means the e-health system does need to deliver on 5 simple but challenging requirements. So it is about delivering the right information to the right person in the right intervention format, through the right channel, and at the right time in the clinical workflow. And if you can achieve all of those, clinical decision support can make a very material outcome in reducing unwarranted variation in care and ultimately better health outcomes. Thank you.